welcome to Doc Talks again this week. I am Dr. Butcher, and this is Dr. Booth, and today we're going to talk to you about growing pains, okay? So what are growing pains, or how do you recognize growing pains? So growing pains are often happening in an adolescent age, but it can be anywhere from middle school up through high school, and then even give and take from there, because everyone develops at a different speed, and so you can see them again kind of across that spectrum, but more in those adolescent years. So when you talk growing pains, they're going to be specific to that age group. We're going to know they're more so a growing pain if there wasn't really a mechanism of injury, meaning there wasn't a big fall, you were in a sport, you did a movement, and ouch, you hurt yourself. Just kind of, hey, pain has developed. And with that too, you will kind of know, hey, this is a growing pain if your child or your adolescent is going through a growth spurt. If you're noticing that you're going shoe shopping or clothes shopping more often, and your kids, you're just seeing them grow, again, we can kind of say like, yeah, between age, no injury, and then them physically growing, that, hey, this is likely a cause or a growing pain versus an actual injury.
Yeah, those are good things to think about. Common places you'll see them in the heel, you'll see them kind of right underneath the knee, around the hips. Those are really big growth centers for the developing humans, so just make sure that those are kind of at the top of your mind if you start seeing some of those things down the foot as well. But if you are concerned about this, when to get evaluated from a professional, if you're having some concerns, sometimes things that spike parents to come and see a professional is if you start to see like a joint that it's not developing maybe normally or how it should look. So if there's like a malformation of a joint, and things look either small or big, or if things get red, swollen, they have a temperature to them often. If you see a big decrease in the child's ability to do things, just everyday lifestyle things, if you can see any of those types of things develop in your kid, and you're really concerned about that, that's when you need to go see a professional to make sure that you don't have anything to really worry about. Of course, some fractures and other things those can actually cause malformations. They can have activities of daily living go severely down, and you can also have like those other red flags of like swelling, redness. So you're looking for those things, and then you're hoping that when you do get it evaluated, it's just a growing pain. But those are the things that would lead you to go see a professional.
Yeah, and if you're ever concerned, of course, your growing years are very, very crucial, so just go see a professional, have them go through an exam, and then have that ease of mind, okay, there's nothing that's necessarily structurally super damaged here that we need to start, rehabbing and treating like a more extensive injury. But hey, we kind of discovered, we have a growing pain. What do we do now, okay? So we definitely want to make sure we try to decrease things that are loading or irritating just as much as possible to help out with, one, personal comfort, and then two, your ability to do things. But if your child is starting to, you notice like maybe they're walking funny, normal movements, walking, running, how they play, you're just noticing that they're either favoring a side or just they look really goofy because they are trying to limit their pain by favoring a side or being on maybe a good side, a good leg, or something like that. That would be a movement that we want to actually then try to dial back that activity, because if they are compromising their movements, it could lead to possible further or an actual injury if they're trying to modify into an abnormal pattern. And limping as well, again, just avoidance, and you can tell too if they're compensating in different ways, and then even just overall feeling like hesitant with movements, things that they would normally jump into really easy without anything. If they look hesitant or uneasy doing things because they know it's going to cause them pain, those are going to be times where, hey, maybe we need to do something further to take away that. And a lot of times you might talk about reducing that activity.
Yeah, I mean, it's a good point because the last thing we want to do is keep an athlete in or keep a kid in some sort of activity, and they get this pattern developed and they learn a lot, especially when we're young, on how to move. And if you're creating a movement pattern that's not super efficient or it has a limp to it, even after you've gotten through your growing pain, maybe that kind of stays with you. Your movement pattern is now developed into that type of a movement. See if we can avoid that. And most of the time we'll have to tell a patient or a parent, hey, we need to pull the athlete for a little bit to desensitize some of the stuff. Or as Dr. Betcher was saying, we decrease the load. We figure out how to make things a little bit more slower, maybe movement-wise, so there's not such an abrupt load into the joint or into the bones that are developing. If we reduce the intensity of movement, so things that can be like jumping or hurdles or things that are like big change of directions, that's fun for kids, but again, we just want to make sure that they're doing it in a safe manner. We might have to take them out of those scenarios a little bit until their bones like really fully develop. And that's usually what we see during a growing pain, is that the bone is trying to develop and grow, and then the tendons are actually pulling so hard that it's actually causing a little bit of pain there. So we need to make sure that stuff really solidifies before we get into those really heavy load movements. So again, if you guys have any questions about any growing pain type situations, please reach out to us. We can give you as much knowledge as we can and try to help you through those situations. If you have any questions, again, reach out to us. Thanks.